All right, today we're going to show you how to get your fluid set up and put onto a fluid pump. So right now I actually have a used bag of fluid, so we already have it connected to whoever had surgery last. And so I'm going to show you how to switch this over so that you can use it. Remember that you want to make sure that your fluid bag is within 7 days or 1 week of being opened. So here we have our drip set. So I have a 60 drip set, and then we have our T-port set that will connect to at the end. So remember, our drip set always has a tearing spot right on the side, so perforated spot right there, easy to open. So we'll open both of these. We can just toss these away. We can take off this paper spot. So we want to first just find the end of our port here so we can connect the two together. So these are going to be the two pieces that we connect together here. This one we just have to pop the top off. It's not a turning one or anything. You can just pop it right off. Make sure that we're not touching any part of this area right here. This is all deemed sterile right there. And then the side for the T-port, there is nothing to take off here, so we just go ahead, and it's kind of spring loaded, so you want to make sure you push that in, and then you're going to take your cap and kind of twist it on there and make sure you have that good seal right there. So now that we have these two parts together, we can go ahead and put in our line into our bag. So first thing we want to do is take our old line out. So making sure that we have the bag upside down, we can take this line out. This is just going to be garbage. But now, since we have an old bag that's already been punctured, we want to make sure that we don't put it upside down, otherwise all this fluid is going to seep out into the ground. If you have a new bag and you just punctured that white piece off, you haven't punctured the actual seal to the fluids yet, so you can go ahead and turn it upside down until you actually puncture with your fluid line. So this, again, remember, this is going to be all sterile right here. So once you take out that old line, don't touch any part of this area. Then we want to take our cap off of our line. This is going to be deemed sterile as well, so do not touch that area. Go ahead and pump it into the bag. And so make sure you get it right in there good. Try to get them to touch areas. So once the bag has already been punctured, it's pretty easy to get that line in there, but if you have to puncture it for the first time, it might take a little bit of extra oomph to get it through there. So before I lay it down, I'm going to make sure that I clamp this first clamp as close to the chamber as possible. This is going to be a nice trick to make sure that you don't have any bubbles in your line when we let the fluid flow through the line in just a minute. So now that we have our line connected, we have our clamp connected, we can go ahead and turn our fluid bag upside down. And then this is where we'll want to go over here to our fluid pump. So let me turn it this way for you guys. So I always put it on the left side of the fluid pump. If you see here, it tells us which way that we're going to be putting it into our fluid pump here. So it's best to always practice to put your bag on the left side already so that you put it on the right side. So now that we need to pure our line through with our fluids, the chamber here needs to be filled before we can let it fill our line. So all you have to do is pinch it, and you'll see that the fluid is filling. I like to do it about 2 times, so make it about halfway full. So that looks good to me right there. So once I see that that is half full, looks good, no bubbles within that area of the chamber, I take my end of the line, make sure I have it over a sink. There's 2 sinks here in the prep room, or a garbage, but typically a sink is nice. And then I'm gonna go ahead and unclamp up here and have my end piece over a sink so that when it leaves the end, it has someplace to go. Reminder, the fluid can get through this cap, so you do not need to take this cap off right here. Just keep it on so that we can keep the sterility of the T-port. All right, so I'm gonna go ahead and unclamp here, You can see it starting to flow. This is a micro drip set, so it's going to be a little bit slower. We're going to let it flow all the way through our T-port, because we don't want any air going through to our patient. Now we see that we've reached the end. I'm going to go ahead and look through my line. Make sure I don't have any air bubbles. We don't want air bubbles going into a vessel, right? Okay, so this looks good. I'm gonna go ahead and clamp off again so that it doesn't keep dripping. And then for this point, if you have a dog, you would just leave it here and use your fluid pump at a later time. If you have a cat, you can go ahead and get it started. So first we want to push and open this up here. So like I said, it tells you the exact direction that you want your line to go. If you were to go to the other direction, we would see that in our line, it would probably start pulling blood out from your patient, and then you would notice that we are going the wrong way. So see this little guy right here? We want to push him up. And so once we clamp that down, it takes the spot of our clamp. So now we can unclamp this clamp up here so that we don't forget once it's time to let our fluids run to our patient. Make sure that you put the rest of your line nice in here, nice and taut. Make sure it's tight right there, and then you're able to close it. All right, so then with this other side, sometimes I just like to put it up here. Make sure this is as close as possible because the rest of this is going to be going to your patient, and you want as much length from the machine to your patient as possible, especially when you're going to be moving your patient. So next we're going to turn our power on. You'll see the directions are all right here, so if you ever forget, take a look at your directions here. The very first thing we're going to do as soon as we turn it on is just hit silent, because it's going to make a noise every so often that we do not want it to do. All right, so if you can see right here, it says 18.5 mils, so that's how many mils the last patient received. First thing we want to do is just clear it, so the button right here is to clear it. All right, so now we have everything is at 0, looks perfect. Our flow rate, so the patient that we're getting ready for is a small cat, so our flow rate is going to be 11 mils per hour. So we're going to hit rate. And then you'll see on the sides that it has plus and negatives. So it's going to be 11 mils per hour. So I'm going to go plus 10 and plus 1. If I went too far and I accidentally did 12, then I go back down and go -1. Okay, so it's super simple. And then I'm going to hit enter. So now we have our flow rate in. Next is this VTBI, which means volume to be infused. So this is how much can be infused to our patient. So next we're going to hit the volume to be infused button on the side here. If you have a brand new bag, we know that a brand new bag has 1,000 mils in it. So we could put 1,000 mils right there and be good, because we can basically infuse this whole bag if we wanted to. 1,000 mils, if we're going 11 mils an hour, is going to take quite a while. But we are going to just minus that real quick. So we have a used bag up here. So if you're looking, the 1,000 is going to be down here. So if we're looking, we have about minus 250 from our bag. So about 750 is what's left from our bag. So I'm going to go and say 1,000 minus 250. So we have about 750 left in this bag that our patient can receive. All right, so I'm gonna put that at 750, hit enter. And so then our patient can just keep receiving its fluids even after an hour. If we've gone past that first hour, it can keep receiving fluids until we're finished with surgery. Next thing we need to do is check our tube size. So if you see up here in the corner, it says tube C. on our little cheat sheet, it will tell us what tube we need. So tube A is gonna be our 10 drip set. Tube B is gonna be our 15 drip set, which we don't really carry anymore. And then tube C is gonna be our 60 drip set. The 60 drip set is what we have right now. So right now we're actually really good, but I just wanna show you guys how to change it if you should ever need to change it. And it says exactly what to do on this little cheat sheet here if you do need to ever change it. So you're going to switch back to the settings. So you're gonna need to hold down the upper left-hand button and the stop button simultaneously, like you're doing a screenshot on your phone. So your upper left button and your stop button. So upper left-hand button and your stop button, like you're taking a screenshot. So just like that, then you can go to your tube right here. So right now we're at C. If we needed to go to B or A, we could switch it right here. So I'm gonna go back to C, hit enter. And then to get out of this, we go back the same exact way. We do that screenshot with the upper left corner and our stop button. And it wasn't fast enough, so let's try that again. There we go. Now it was fast enough that time. So once we are connected to our patient, which we'll just pretend like we are, and I'm just gonna put it in the sink here, we can go ahead and hit start. And so I've unclamped it up here, remember, so there shouldn't be any issues. We have a green light. You can see right here that it is showing that our fluid is going through. 11 mils an hour is going to be very slow, so I just want to wait to show you guys that we are adding fluid. So there we go, we got a 0.1 mil given to our patient. And so, like I said, 11 mils an hour is going to be very slow, so you're not going to see that add up very quickly. But by now, within the first 5 seconds, you would get an alarm, or it would turn red, or it would kind of alarm at you if anything was wrong within the machine itself. So looks like everything is good. We can just keep giving our patients their fluids and keep going on with surgery. So if you have any questions, just remember to return back to this video. All right, thanks guys.